In Manganum Aceticum, the electron charge varies from +1 to +2 to +3, +4, +5 up to +7. As the charge varies, its color varies accordingly. Just as there are different colors of the feathers in the same bird, Manganum also has a variety of colors. Incidentally, Manganum is aggravated by feathers. Even the slightest exposure to feathers can bring on an allergic response or an asthmatic attack.
The causative factors are suppression, prolonged anxiety, fright, tensions, emotions, suppression of discharges or eruptions, and getting wet.
Manganum is a person whose main desire and endeavor is to please others. He or she wants acceptance and acknowledgement that whatever they have done was done well and enough. As a child, he will go out of his way to please his parents, his teacher, or any higher authority. He will run and do things for them. He will clean up the blackboard. He will go to the car and pick up things. He will run errands obediently and will constantly help others so that everybody says, "He is a good boy."
This quality extends throughout their life. A housewife expects her husband to appreciate all that she has done for him and for the family. She wants constant feedback that whatever she's doing is being appreciated by all.
Manganum is very open, sympathetic, friendly, adaptable and helpful. They will neglect their own work and will go out and help others. During exams, instead of writing their own paper, they will help others to answer the questions. They are very sympathetic to the poor and to people in difficulty. They are friendly and will go out of the way to say hello to everybody in school, college, at a party or at a function. Another remedy is phosphorus. They are not adamant or fixed. They will adjust to time, circumstance, place, object, person, etc. They will do their utmost to ensure that relationships remain healthy, friendly and alive. A typical profession that Manganum will choose is that of a nurse or a social worker. But after doing everything, she needs a warm pat on the back or a few words of appreciation. If she doesn't get appreciation, it affects her deeply. She feels hurt, and the negative phase of Manganum can start from here. She has to be told that whatever she has done was well done and was enough. Be it a nurse, mother, father, wife, husband, child or daughter, all must appreciate her.
Manganum is very sensitive to the needs of others. She understands what is required and adjusts and succumbs to the needs. She is always busy taking care of others. Another remedy is causticum. Because of their high level of sensitivity, they get affected by external influences, especially music. La 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 la. Their moods change according to the music. Music can depress them or music can make them come alive. Another aspect of their sensitivity is clairvoyance. They can perceive events before they actually occur. Other remedies are phosphorus, lachesis, tuberculinum, medorinum.
As they are sensitive and are worried about others, they develop tremendous anxiety. Anxiety is predominantly anticipatory, with a feeling that something will happen. Another group of remedies are the Kalis. They have a feeling that something will go wrong, and these feelings make their life miserable.
Along with anxiety, there is a sensation of a band around the head. Oh. Or they hear bells ringing all the time. Tring, 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 tring. The anxiety is so marked that if when they try to walk, they end up running forward. There is one concomitant with anxiety. More the perspiration, more the anxiety.
As this patient is very sensitive, he or she gets hurt very easily. This can be expressed in a number of ways. He or she withdraws from the circumstances and starts avoiding people, avoiding company, avoiding parties, friends, etc. Aversion to company can become so marked that the presence of others aggravates the patient. Angry +3. Natrum mure is another remedy. The patient gets very angry, so much so that talk of others aggravates. There's a constant frown on the face and a clear, bitter expression. Marked restlessness and anxiety.
Sadness and depression. This is the phase when many patients will usually report. But if you have to decide manganum as a prescription, you will have to study their past history, their generous nature, benevolent attitude towards others. Sadness is not superficial, it is deep down in their heart. Another remedy is natrum mure. They develop aversion to talking and are better by sad music. Da, da, da. Joyous music aggravates them. They are worse by laughing and cannot take any jokes. As the depression goes deeper, they start desiring many things, which they refuse when they are offered. Other remedies are chamomilla and cinna. In cinna and chamomilla, it is due to irritability, while in manganum, it is due to their anxiety and depression.
Loss of memory and forgetfulness +3. Dreams of reconciliation, as if they have patched up with the people with whom they have had a fight.
The dreams also express this state as if things are changing too quickly. Subconsciously, he cannot move, as is evidenced by the desire to lie down or rest because of depression. But the mind takes a big jump and expresses as if things are changing very fast.
When this phase of depression continues for a long time, it can even involve body and mind at a deeper level. That is, they have loss of control over their mental and physical faculties. They laugh and weep involuntarily. There is no control over their emotions. They also lose control over their gait. It is feeble, slapping and staggering. At the pathological level, the disease progresses and the patient develops partial or general wasting and further loss of control at the level of the nerves and muscles. He cannot walk, but he can run better. Manganum is an important remedy for degeneration. Degeneration of liver, brain and spinal cord, bones, etc. Due to this degeneration, there is progressive paraplegia and paralysis. Although there is paralysis, reflexes are exaggerated and sudden. Anemia with destruction of red blood corpuscles.
Infection, inflammation, suppuration and ulceration of inner ear, larynx, mesenteric glands and kidneys.
The patient has vertigo with a feeling of falling forward, which is aggravated by sitting and standing. The ears are blocked, which get better by blowing the nose The discharges are yellow, thick, bloody, lumpy, green and offensive. Every cold settles in the chest. That is, the patient suffers from bronchitis. Dulcamara is another remedy. Cough is better by lying down, better by smoking, and it gets better in the open air.
It is an important remedy when girls and boys are experiencing a change in their voice. Also, it is an important remedy for speakers and singers. La 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 la. The other remedies are Argentum nitricum, Gelsemium and Arum triphyllum. Long bone rheumatism and affection of connective tissue and cartilages.
There is a great soreness of the parts. Other remedies are Arnica nicolam. It is also an important remedy for malignancy progressing slowly and gradually. The aggravations are bathing, local heat, while eating, cold damp, music, noise, feather pillow, cold food, ice creams, movement, touch, speaking, change of weather and talking.
The ameliorations are sad music, indoors, lying down +3, earplugs, covering, foggy, cold, walking backward. Colic is better by bending double. Clinical: ataxia, albuminuria, myasthenia, diabetes, affections of pancreas, jaundice, joints, psoriasis, urticaria, paraplegia, progressive, early tuberculosis.
Differential diagnoses are cuprum, ferrum, graphites, phosphorus, sorinum, sulfur.